Welcome to the CAMPS Center for Advanced Manufacturing Puget Sound Medicare 101. Are you at least 65 years old and retired? Are you at least a 65-year-old employee not eligible for benefits? If you work or worked for a participating CAMPS member employer, this program may be a great opportunity for you. In the coming slides, we're going to look at Original Medicare, how it works, options beyond Original Medicare, and Medicare and health savings accounts. Qualifies for Medicare: citizens of the United States or permanent residents for 5 consecutive years who are 65 and older, under 65 with a disability, and have been receiving 24 months of Social Security disability income. Individuals of all ages with end-stage renal disease, ESRD, or ALS. Individuals at any age who have certain disabilities, or individuals who have end-stage renal disease, permanent kidney failure, or ALS, Lou Gehrig's. Medicare has 4 parts. Part A is hospital insurance. Part B is medical insurance. We call Medicare A and B Original Medicare, and it is administered by the U.S. federal government. Medicare Part C and Medicare Part D are offered by private insurance companies approved by Medicare. Part C combines the benefits of Part A and Part B and any additional benefit private plans have included in addition to the original Medicare benefits. Part D covers prescription drugs. Part A helps cover inpatient care in hospitals, skilled nursing facilities, hospice, and home health care. You pay Medicare Part A deductibles, coinsurance, and copays. Your share of the Part A costs in 2023. $1,600 deductible for days 1 through 60 in each benefit period. $400 per day copay for days 61 through 90 of a hospitalization. $800 per day for days 91 through 150 of a hospitalization. Skilled nursing facilities, $200 per day copay for days 21 through 100. You usually don't pay a monthly premium for Part A coverage if you or your spouse paid Medicare taxes while working at least 40 quarters or 10 years. Those who have credit for working 30 to 39 quarters, the standard Part A premium in 2023 is $278. For those who worked and paid Medicare taxes for fewer than 30 quarters, the standard Part A premium in 2023 is $506. Part B helps cover preventive services, doctor office visits, outpatient surgery, lab tests, x-rays, CT scans, MRIs, durable medical equipment such as diabetic testing supplies, and Part B drugs such as chemotherapy. With Part B, you pay a premium, deductible, coinsurance, and copays. $164.90 is the monthly standard Medicare Part B premium in 2023, generally deducted from Social Security. The monthly Part B premium varies for high-income enrollees. $226 is the 2023 annual Part B deductible before Medicare pays 80% for most Part B services. No maximum limit on Part B out-of-pocket costs. This is the Medicare premium by income for 2023. Medicare looks at your modified adjusted gross income 2 years prior to the current year. For example, in 2023, they look at your 2021 modified adjusted gross income. The Part B premium and income considerations adjust annually. When to enroll. The initial enrollment period, IEP, is a 7-month window beginning 3 months before your birthday month to 3 months after your birthday month. You may enroll through ssa.gov or by calling 1-800-772-1213. If you're receiving Social Security before 65, enrollments in Part A and B is automatic. You can enroll in Original Medicare Parts A and B and add a prescription drug plan, or you can enroll in a Medicare Advantage plan which includes both medical and drug after enrolling in Original Medicare A and B. What if I work past 65? If you don't enroll into a Part B when first eligible, there may be a 10% penalty for each year you delay applying. You may avoid a penalty if you or your spouse is actively working and you're covered by an employer group health plan. Working past age 65, a special enrollment period. There is an 8-month enrollment period that begins the month after your employment ends to sign up for Part B without accruing a late enrollment penalty. Your employer or HR department can provide you a verification form. General enrollment period, January 1 through March 31st. A late enrollment penalty may apply. Examples of services not covered by Original Medicare. Keep in mind, Original Medicare is Medicare Parts A and B. Prescription drugs, which can be secured separately with a Part D plan. Long-term care or custodial care. Additional dental coverage. Routine vision exams and eyewear. Routine hearing exams and hearing aids. Some alternative care such as massage or naturopathy. Fitness memberships. Care outside of the United States. Over-the-counter expenses such as bandages, vitamins, etc. There are 2 ways to get additional coverage. After learning about Original Medicare Parts A and B, most people understand that Original Medicare is just not enough. There are 2 paths you can choose from to improve your Medicare coverage. First, Medigap or supplement plans are designed by the federal government and administered by private insurance companies. Like Original Medicare Parts A, B, C, and D, they are identified by letters. They're called Medigap plans ranging A through N. They provide coverage for some healthcare costs that Original Medicare alone doesn't cover, such as copays, deductibles, or coinsurance. Medigap plans pay secondary to Medicare on Medicare-approved expenses. If Medicare denies a claim, the Medigap plan does not pay. You must be enrolled in Medicare Parts A and B before you can enroll in a Medigap plan. Medigap plans do not include prescription drug coverage, but you can purchase standalone Medicare Part D coverage. Medigap plans are not tied to a network. They use providers that accept Original Medicare. Some plans also have foreign travel emergency benefits. If you purchase a Medigap plan, you pay a monthly premium. Many Medigap plans have lower out-of-pocket costs than other Medicare options. However, they usually cost more than a Medicare Advantage plan. The next options are Medicare Advantage plans or Part C plans. They are health plan options approved by Medicare and run by private insurance companies to provide your coverage. When you choose to enroll in a Medicare Advantage plan, you choose to have a private health insurance carrier administer Medicare for the federal government. They provide your Part A hospital insurance and Part B medical insurance benefits, and cover all medical necessary services that Original Medicare plan provides. They can also cover additional benefits like vision, dental, and hearing. Medicare Advantage plans may have copays for services, and they also have an out-of-pocket maximum to protect you. Medicare Advantage plans usually include Medicare prescription drug coverage. Everything is bundled into one plan with one card that you can use at the doctor, hospital, and pharmacy. Medicare Advantage plans with prescription drug coverage usually cost less than enrolling in Medicare Parts A, B with a Medicare supplement and an additional Medicare Part D prescription drug plan. Let's look at the Regents Group Medicare Advantage plans. Like the Medicare Advantage plans discussed on the prior slide, they replace Original Medicare as the primary payer of Medicare Parts A and B, and they include Part D drug coverage. They include extra benefits such as dental, vision, and hearing aid coverage. The provider network is a nationwide PPO network. The premiums are lower than Medigap plans and requires only one ID card for services at the hospital, the doctor's office, or the pharmacy. The Regents Group Medicare Advantage plans have a few unique advantages compared to other Med Advantage plans. They are portable. You can live anywhere in the U.S. and enroll onto the plan. They have continuous open enrollment. Enroll any time of the year. And last but not least, you are guaranteed issue onto a Medicare supplement if you decide to make a change in the future. With a group Med Advantage plan, you are still required to enroll in Medicare Parts A and B, and you must continue to pay your Part B premium. Health savings accounts, HSAs, and Medicare. How do Medicare and health savings accounts work together? Once enrolled in Medicare, you no longer can make HSA contributions. If you plan to work past age 65 and plan to contribute towards an HSA, do not enroll in Medicare Part A or B. You will need to stop making HSA contributions at least 6 months prior to enrolling onto Social Security. Once 65 and eligible for Medicare, you can use your HSA funds to pay Medicare Part A, B, C, or D premiums and out-of-pocket health expenses. You cannot pay Medigap premiums with your HSA. You can use your HSA funds to pay premiums for an employer-based retiree coverage if you are 65 or older. Thank you for your time today. If you have any Medicare-related questions, or you would like to learn more about the special CAMPS Med Advantage plan, please email or call me, Mike Jackling, anytime.